Good morning, AXA. My name is Sherry, your Claims Director from AXA Philippines, and welcome to Health Check. In this segment, we will be talking about health claims, specifically on major critical illnesses, and how we, as distributors, can set the right expectation to our clients. To kick off, we will focus on the top claims driver, cancer. Cancer coverage can be very technical to understand, much more explained. So we as distributors should know how to properly manage the expectation of our customers. For today's video session, we aim to give you useful information on the classification of tumors and cancer, what's covered and what's not under critical illness benefit for cancer, managing your customers' expectations when filing claims. To understand cancer, we need to know how cells in our body grow. Normally, cells grow and divide to form new cells as your body needs them. When cells grow old, they die and new cells take their place. Sometimes, this process goes wrong. New cells form when your body does not need them, and old cells do not die when they should. These extra cells can divide without stopping and they form a tumor. A tumor is an abnormal growth of cells that serves no purpose. If the tumor does not invade nearby tissue or spread to other parts of the body, it is called a benign tumor. In most cases, the outlook with benign tumors is very good. Sometimes they require treatment and other times they do not. If treatment is needed, it usually involves surgery, and once operated on, benign tumors usually don't grow back. If the tumor cells grow, invade, and spread to other parts of the body, it is called a malignant tumor or cancer. Different cancers are treated differently and have different outcomes for the patient. For instance, thyroid cancer is different from liver cancer. If caught early, thyroid cancer is a very treatable disease, and patients can look forward to a successful cure and a normal life expectancy. On the other hand, liver cancer is an extremely invasive cancer, and most of the time it is detected at a later stage and the outcome is usually poor. For major critical illness benefit under cancers, benign tumors are typically not covered because there is no aggressive treatment required, and doctors may simply advise watchful waiting to make sure they cause no problems. In addition, tumors that are classified as pre-malignant or dysplasia, some skin cancers, some early prostate and thyroid cancers, and early-stage chronic lymphocytic leukemia are not covered because these types of cancers have a high survival rate or are easily cured. For major critical illness benefit under cancer and subject to the assessment by the claims team, malignant cancer stage 1 and above are covered. Again, subject to our assessment of biopsy reports and other medical documents, leukemia, malignant lymphoma, Hodgkin's disease, cancer of the bone marrow, skin cancers, and other soft tissue cancers are covered. If your customer reaches out to you and requests to file a claim, always know the full extent of the case and gather all necessary information. Bear in mind the following tips. Number 1. Visit the client personally. On top of being the best thing to do for a customer, this is a better way of knowing the details of the claim as you get to personally check on the client, review the contract, and ask all requirements then and there. Number 2. Ensure that there is a biopsy report. This is a requirement to claim for cancer benefit because it is the medical document to confirm the cancer diagnosis. Number 3. It is strongly advisable not to guarantee that a cancer claim will be paid even in the presence of all requirement and evidence. what we recommend is to advise our customer that, I will go ahead and submit the claim, and upon receipt of the head office of all the requirements, the claim will be processed within 20 working days, and in some circumstances, the claims department might request for additional documents, but rest assured that I will inform you of all developments of this claim. That's just a sample spiel. We in claims thoroughly assess and analyze the documents submitted and ensure that the insured's medical diagnosis is aligned with the terms and conditions in the policy contract. I hope you learned a lot on critical illness claims under cancer in this short video. So always remember these takeaways. Number 1, take the time to study the policy contract and its benefit provision to give us an idea of what is covered under the plan. Never guarantee that the claim will be approved. And last but not the least, managing your customer's expectation is the key to proper claims handling.